Yeah, but there's something going to attend as we know. Oh, yeah.
Good morning, everyone. Are we ready to start our luncheon?
Hi, Bella.
All right. Are we eating this great food? All right. Well, I'm going to start the luncheon meeting as Steve Neuer, our current president, is running a little bit late. So we're going to get the ball rolling. We've got a great lineup for you today and a couple of special announcements. We want to thank you for coming to our DAHU monthly luncheon. It's held here at Prestonwood Country Club. We have this every Wednesday. One Wednesday, the third Wednesday of every month, sorry. And then we have special events where we'll be at a different location. So hopefully you're checking out our dahu.org website to stay up on our current events. So we've got a lot happening and coming up in the future. So let's get started. So I'd like to start with the Pledge of Allegiance. So everyone will stand, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing. Don, would you take us in our invocation? Or benediction, sorry.
We bow your heads with me, please. Heavenly Father, we thank you for this wonderful opportunity we have to gather together as this fellowship of like-minded people and profession that gives us the opportunity to truly help people. We would ask you to bless each person in this room, give us safe travel both as we got here and back home, and pray that you'll bless this food, Lord, both for our nourishment and strength, and us to thy service. In Jesus' name. Amen.
Donna brought to my attention somebody left their Aetna at the last luncheon. Did anybody lose their Aetna portfolio? It has a pink sticky in it, and it's got a bunch of notes in it. So if you're here, let us know. Not just your handwriting. We'll be happy to return it. Okay, let's go through for today's meeting. We're happy to have our. Okay, Steve, welcome. Do you want to take a breather? Or are you ready? Okay, we're just getting ready to start to do the introduction for Medicare.
Oh, please.
Yes, we did our pledge. I didn't do some about our meetings.
Good morning, or almost good afternoon. Sorry for my tardiness. Unforeseen circumstances. Not that anybody should have those. Okay? Anyway, thanks for attending. We really are happy that you're all here. I hope you had a little time to network in my absence and get a good bite to eat or something. And we'll get the meeting started here. Let me take care of a few housekeeping items. And thank you, Tamla, for taking over there for me. Appreciate it. Want to mention today's sponsors, Foster Benefits. Would you guys, anybody from Foster would like to come up and make an announcement? All right.
Thank you. Good afternoon, everyone. I'm Caroline Page with Foster Benefit Resources. We are a general agency with Redefining Healthcare. Also work with Allied National. Big question right now with the whole AHPs. Yes, United Healthcare is writing the Association Health Plan. So please bring us to business. We'd love to work with you. Thank you.
What you got to talk over there?
We do small group, anywhere from 1 to 50, mid-market, 51 to 99, and key accounts, which is 100 plus. Ancillary products, we write those as well, dental, vision. In your mid-market, we have a great thing called U-Bundle. With U-Bundle in your 51 to 99 market, you can actually get a discount on your premiums, anywhere up to 4% by adding on those ancillary products. How about that?
That's great. Thank you. I'm sure. And yeah, they're our annual lunch sponsor, so they need a big hand. Let's do it again. Thank you. And she stretched it out a little bit for me, but I needed. Thank you. All right. Just want to make sure we cover all our sponsors too. We have a kind of a new sponsor, at least. We have a semi-annual newsletter sponsor, Medicare Benefits. Anybody here from Medicare?
Mitch, you want to say anything?
I'm sorry, Medicare Healthcare. Sorry about that.
Raise your hand, Mitch.
Okay. All right. Well, moving on. I'd first like to recognize our visitors. Do we have any visitors with us today? No visitors? All right, how about new members? Liz, are you here?
No, we got a visitor here.
Oh, we got a visitor. Okay. And you are?
Deborah Hildebrand.
And Deborah Hildebrand?
Uh-huh.
And you're from Hildebrand then? All right.
The Plexus Group.
The what group?
The Plexus Group.
The Plexus Group, okay.
Yep.
Well, welcome. We're glad you're here. Thank you. All right, Liz, any new members here? Do you want to?
Can we say something?
Sure. Come on.
I'm Tahoe Pack Chair Liz Patterson, and on your table there is a quad Tahoe Pack fact sheet and some contribution sheets. So if you're not a Tahoe Pack contributor, you might be a new member, and you might pick this up and find out why we want you to be a Tahoe Pack contributor. Texas supports candidates and their political campaigns. These lawmakers support Tahoe's values and initiatives. So we want everybody to consider being a Tahoe Pack contributor. You can be a gold member for like $150. And we encourage all new members to do that. Pick that up. If you don't find one on there, contact me and I'll email you one. Be glad to help you out.
Thank you, Liz. We really, it's such an important part, if not the most important part we do is through our PAC, both through Tahoe and non-PAC. So it is important. We really appreciate it. And if you don't become a gold member like her, you know, you could be a rust member like me maybe or something. No, I think I'm gold, aren't I, Liz?
Yeah.
I think so. Okay. Donna, she was standing back there. Okay. Is there any new members who want to address or introduce?
No, just remember that we have this membership contest, so I've got a few of you are in the drawing, but if you bring another member, a new member to the luncheon, remember.
They can't quite hear you. Can you speak up just a little?
I thought I was just being loud. Good to know that I'm not as loud as I think I am. Anyway, we have a few. We have two right now. Members from our February luncheon that have sponsored a member, and they're going to be in the drawing. And then for May is the big drawing, and for each member you sponsor between now and May, that gives you between our now and our May luncheon, which is around the 20th. Yeah, I think it's around the 20th. 15th. Oh, all right. Okay. Around May 15th. You get an entry in the grand prize drawing of the $500. So I just want to let you know we're going to be drawing for the February for the two people who brought in new members, and we'll have a drawing for the $50. So just to let you know, but thank you all for joining. I know we have a couple members here who did join at the symposium, and they're here today, and we appreciate you coming. Thank you so much.
Thanks, Donna. Okay, next, Carol. Do you want to come up a little bit?
Hi, I'm here to talk about this wonderful event that's going to happen in Dallas next week, beginning April the 24th through the 26th. It's our own state convention. It's coming to Dallas. We're drumming up attendance. We're drumming up sponsorships. I have sponsorship forms, and the one thing that we really want to focus on is what's going to happen on Thursday night. Thursday night, TAA2 will recognize its most outstanding member for the year. It's called the Hollis Robertson Award Dinner. Anybody not heard about Hollis Robertson? Oh, good, you all know. That prestigious award was first given to Mr. Robinson, who was almost going to be a Henry Dawson, that's not Henry Dawson, what is the national award? The big award at NAHU, we forgot the name. There are 14 people on the list of winners of this award who have come out of the Dallas-Fort Worth area. The award was started in 1989. So just to tell you who, started with Hollis, then there was Donna Cardall, she was with Fort Worth, Bob Campbell from Fort Worth, Henry Dawson, one of our founding members from Dallas, Andy Wolfson, another one of our founding members. The first state convention I attended was the night that Andy won the award. Anybody recognize the name William Peterson?
No.
Oh, no, she's gotten that award. I remember I was in charge of the convention that year as a CAHU officer, and somebody sent me looking for a mop and a bucket because they knew that there were going to be a lot of tears when she won, and there were. I never found a mop and bucket. Then Trey Wild, who happens to be the stepson of the original winner, Mr. Hollis Robertson. Stan Foster from Dallas. David Pruitt from Fort Worth. Mr. Briscoe Dunn from Fort Worth. Yours truly from Dallas. Mike Smith from Fort Worth. And then last year's winner, year before last winner, was our own Luann Trevick, who's here with us today. And then last year was Laura Firestone. We want you to come, we want you to attend. If you don't have information, you can see me, or you can go to www.tahu.org for information. We need sponsorship money, guys, and I've got a deal to give you. The deal is the sponsorship of the Hollis Award itself. Normally a $2,500 commitment, going today for $1,500. So if any of you are companies and you're interested in being part of this, please see me after lunch. Thanks.
Can I carry on after Carolyn? A little bit more about the convention, right?
Yeah, the biggest thing is the discounted price ends today, right?
That's right. The convention, on your table, you'll see the colored paper, and on the back is the agenda. Most importantly, there's CE credits to be gained by attending the convention, and if you have not gotten your ethics requirement, it's being offered at the convention. Just so that you know, Dallas is not offering ethics this year, so if you need it this year in order to meet your qualifications, that's where you'll need to go. But did want to call to your attention the various seminars, CEs, and activities at the convention. And I also kind of wanted to know from you guys, who has been to a convention before for Tahoe? Well, I am proud to say that when I got into this business 7 years ago, I have been to every convention that Tahoe's put on since I became an agent. So, well, I don't know if anybody else can beat that, but hey, would love to have you come next week. So thank you.
Thanks.
Put the challenge out there.
Challenge is there.
Just one more thing about the convention. June Pearson will be speaking. And there is, let's see, health plan regulations, Tina Godfrey from the senior advisor from the Department of Labor about investigations. Many of you are probably under investigation, so you might want to be there to find out. Anyway, it should be an interesting seminar. So good luck, see you there.
Thanks, David. David is, in case some of you don't know, he's our money guy. He uses all straight, or tries to. Okay, so, next, why don't we have Mary Lou, you want to come up and I think you have a guest with you today, right?
I'm very, very honored to introduce our guest today.
Speak into the mic.
I am. I'm very honored to introduce our guest today. And thank you all that participated in our lemon drive to give to the Operation Once in a Lifetime. Our Sergeant Patrick Sowers started this organization to help our veterans in many different ways. But the reason we have the limit drive is to help our troops as they come back from overseas. The government does not provide these things for our guys when they come back in the barracks. So we try to provide these for them and have the sheets and the pillows and the toiletries and towels and whatnot, so they have something in the barracks when they get here and kind of make it feel homey for them. But there's so many other things. I'm gonna let Patrick tell you kind of what they do. They also have a store in Plano, where the families can get furniture and clothing and different things. But they have a lot of things they do for the troops, and that's why we decided to back them. I guess last year was the first year, right? And it's just an honor to help these guys, because I don't know about y'all, but I'm a 100% patriot, and the more we can do for our troops, the happier I am. But thank you all for contributing. If anybody didn't see the notices, you didn't have time to go shopping, I'll be glad to come around and collect any money that you might have, and I'll give that to Patrick as well, and he can pick up what he needs. So I can be collecting that as he speaks, okay? Thank you.
Well, I hope you don't mind. I pride myself on being really loud. I kind of like to be in the center, if that's okay. My name is Sergeant Patrick Sowers. I'm with Operation Once in a Lifetime. Oddly enough, I know we're in Dallas, but we are Pittsburgh Steelers Troy Polamalu's secretary. Big hairy guy, does all the funny head and shoulders commercials and stuff like that. That's retired, stuff like that. Operation Once in a Lifetime's core mission, when we originally created it, was to create once-in-a-lifetime experiences and opportunities for veterans and active duty service members and their families. Kind of like a make-a-wish. We started to team up with organizations like the Dallas Mavs and the Dallas Stars and the Texas Rangers and taking guys out to, these once-in-a-lifetime experiences that often they wouldn't be able to afford. I mean, living in Dallas, we're a very blessed community. When I got out of the military, I went from making $40,000 a year in the military to making $140,000 a year sitting behind a desk with no degree. And I always got invited to Mavs games, Stars games, Cowboys games, in a suite, on the field. But I don't risk my life. I'm in a suite, and I can literally eat and drink whatever I want like this. To me, it's like, if I was still in the military, I would never have these opportunities. So that's how we started. Just taking guys out to a couple games before they deployed, maybe have some memories for their kids. There was a few instances where we were taking these soldiers and their kids to Rangers games, Mavs games, or some kind of once-in-a-lifetime experience, and that soldier died in combat. But that family kind of had that lasting memory. But then, as the news station started kind of filming us and stuff like that, they started man, you're granting wishes, and you're making dreams come true. And I'm like, yeah, yes, we are. And that's when everything changed for us, right? So we pride ourselves on two major things. We pride ourselves on being this Make-A-Wish Foundation for the military. We also pride the fact that we recognize practical wishes. If you did not have food, what would you wish for? If you're coming back from Iraq and Afghanistan and you're single and living in barracks and all your issues is a mattress, what would you wish for? Toilet paper. Right? Yeah, I was very fortunate. My wife picked me up. I have a house, I have an apartment. Everything's furnished with the single guys and women. When they come back, it is true. It is only an Army thing. We don't get mad about it. I ain't blaming Obama. I ain't blaming Bush. I ain't blaming Trump. We're military. It is what it is. We'll sleep on the ground if we have to, right? But it is nice to come home to something. Right? Think about it. We're on a 72-hour driving restriction. Right? We're dodging, moving, getting out of the way of stuff that might blow us up. So you come back, you don't have nothing, you live in the barracks, you drop your bag, and all your issues is your standard room, wall locker, a bathroom with nothing in it. And my wife picked me up, everything's all set at the house, she took care of everything. Whereas the single soldiers, they have to drop their bags and get an Uber. And go spend $100 at Walmart. It is nice to come home to something. And the biggest thing is, the true honesty is no soldier, this is the truth, man. It's a very selfless thing that you guys do, because no soldier's going to lay in that bed and wonder who got in that building. But they're just going to be grateful that they got to drop their bags in the last 3 months. And that's what you guys are providing, right? This is not a Marine thing. I get some Marines that get off and out and say, oh, this never happens. You're right, it doesn't happen in the Marine Corps. It happens in the Army, right? And there's actually a long, great story of why the military doesn't provide it anymore. And that's kind of a long story. And I'll provide it as well. But in literally 10 years, we have helped over 550 100,000 veterans in active duty service. One of the biggest things that we're really into now is like we have 18 programs. We have an educational spouse program. We have our core mission, the once in a lifetime. We actually have a great once in a lifetime opportunity coming up for some veterans. Every year we try and take 50 veterans to Arlington National Cemetery who have never been before. From all genres. Iraq, Afghanistan. We have a 97-year-old World War II vet on this year's trip. Right? We have a 21-year-old Afghanistan vet that lost 3 guys in the last war. What people don't understand, when you're in combat, and one of your guys dies, the body's sent back home, the funeral's back home, the burial's back home, but where are you? You're still there. For a lot of guys and women, they never have this closure. Right? So that's what we call the trip. We call it Operation Closure. We have 50 veterans wanting to go on this year's trip. We've raised enough money for 28. You know, if anyone's ever, interested, every $700 we raise, that pays for a veteran. You can donate airline miles. Matter of fact, I tell people all the time, I don't care if you donate money to us, I will give the veteran's name, date of birth, airport they're flying out of, airport they're flying into, and the hotel we're staying at. You can pay it all directly yourself if you like. The biggest thing is about being transparent. The other thing that we're really big about too is we're also big about mentorship, right? And helping veterans. There's a lot of people this is kind of a real popular subject amongst veterans, how veterans are taking their lives. There's this huge study of 22 veterans take their lives every day. But what I hate about that study is no one tells the truth. Everyone thinks we're this PTSD, disabled, broken veteran community. They do. I see. I spoke at a convention with 5,000 people and asked this lady, I said, when I say veteran, give me the first 5 things that come to your head. Hero. Soldier. Homeless. PTSD. Suicide. That's how they see us. Right? And what's funny is, I was on the phone, I thought it saw me, I was on the phone. I was on the phone with that veteran that wanted to kill himself. Now I was talking to one of his friends out on the phone, out in the lobby out there, of why he wanted to do it. Matter of fact, you guys actually helped save a veteran's life, Mary Lou. This is a real text message, right, for that veteran that she just helped write a check for $400. This veteran wanted to take his life. And what we did is we didn't just give him the money, right? And the thing is, the truth is 90% of the veterans that are struggling, they're not struggling with war. They're not even struggling with the past. They're struggling for what they're going through right now. If you can't feed your family, are you going to be more prone to suicide? Absolutely. You have no electricity on and your kids come home with no power, will you have thoughts of suicide? Absolutely. She writes a check, and this is the text message I got. I just wanted to thank you. Thank you again. You put food in my kiddo's mouth. You helped me get my lights and air back on. I'm working, getting my brain out of this victim PTSD mindset and turn it into something better for my family. You might not think you've done much for me, but you helped me more than I could ever tell you. So what's funny is we often get the credit. The credit belongs to you. To all you guys. All right, so that's what you guys are supporting, and thank you guys.
You said they didn't wonder about where the gifts came from, where the limits came from. I'll bet when they say they're not OD green, they have an idea too.
Yeah.
Anyway, they're thankful not to have OD green, I'm sure.
Yeah, no wool blankets.
Anyway, thanks very much. All right, and thank you all for making all this stuff possible. We really appreciate that. Now, I mentioned that one of the most important things we do maybe is our legislative efforts supported by your time impact and your non-impact dollars. But we are going to give you a little update today. Taylor is, I think, going to give us an update both on the state and federal legislation. Our own star, Taylor Kirkhardt. Thank you, Taylor.
Thank you, Steve. I'm going to start with just a couple federal updates. So we had the HRA proposed rule released back in October that would allow employers to offer an HRA to be used to purchase individual coverage in lieu of group coverage, and for an HRA to be used for accepted benefits coverage. We may see a final rule released released by June in order for health plans to start planning to implement this for 2020. Additionally, legislation has been introduced in the House to delay the health insurance tax through calendar year 2021, and in the Senate to repeal the Cadillac tax. A couple weeks ago, CMS announced guidance allowing states to extend grandmother plans through 2020, and they released the AB calculator for the 2020 benefit year. A U.S. District Court ruled the Association Health Plan final rule unlawful. The rule's interpretation of employer to include working owners and groups without a true commonality of interest was considered unreasonable and has been deemed an end run around the ACA by Judge Bates. This is in the process of an appeal, but the rule is still in place until a final decision is made. Also, just last week, the Fifth Circuit Appellate Court scheduled oral arguments to begin the week of July 8th for the Texas v. United States case challenging the constitutionality of the ACA. The appeal challenges the lower court ruling invalidating the entire ACA due to the zeroing of the individual mandate penalties. So switching gears to what is happening at the state level, I'm personally really impressed with how well our members are being represented at the state capitol with the help of our THU lobbyists. Some of our members have testified on issues such as surprise or balanced billing, and many Texas legislators are becoming more familiar with who we are as an association. It has been a very busy legislative session with just a little over 5 weeks remaining. Our THU Legislative Council is closely monitoring bills that are being introduced, especially those that are related to or would affect the insurance industry. Just yesterday, the Senate passed Senate Bill 1264 in order to provide relief to Texans that receive surprise medical bills. This proposal would allow for an arbitration process that takes the patient out of the billing dispute. They also passed a companion bill, Senate Bill 1530, which allows self-funded insurance plans to opt into the mediation provided by TBI. Both bills now move on to the Texas House. Our lobbyists and legislative council are also monitoring bills related to air ambulance agreements, freestanding emergency rooms, multiple employer welfare arrangements or MWAs, and the creation of a temporary hybrid high-risk pool, just to name a few. There's certainly a lot of action going on at the state level, and it'll be interesting to see which bills get passed in the House and then the Senate before the legislative session comes to a close at the end of May. Thank you.
Thanks, Taylor. With all that going on, I can remember a few years ago that I heard a lot of talk amongst some of us. I think maybe some of them are out of the business now, but we're worried about Obamacare, ACA, and of course we had a good right to worry, but a lot of people were so pessimistic that they got out of business. Aren't we glad we stayed? Don't we think our clients need us ever more than ever now? Can they figure this out? I mean, it's confusing to a lot of us, much less our clients. So you guys keep out there. We got plenty to talk about. We got plenty to bring to our clients, bring to the table for our clients. So congratulations, you're all our stars, and I'm sure you're stars amongst your clients. So we thank you for that. We thank you for your participation. And we got other stars like Don was bringing membership. They got a great, we're doing some great things. We're trying to get a last push. In fact, I'm going to add to that. If anybody would like to take me up and wins that award, I have a bottle of wine I just might throw in out of my cellar. And those who don't know, I'll give a little bit of a cellar. So anyway. All right, anything else before I bring Reed up to bring our speaker? Anything for the good of the order? Okay. I'll cover real quickly. Go ahead. Come on up. Our program in May is going to be everything you want to know about DI, but didn't know to ask. And in June, make sure, because we're getting into to vacation time, a lot of it's going to be gone. But if you put the June meeting and work around that, I think it's a little different venue, but I think you're really going to like it. it's business tax strategies for us and other small businesses, your clients. So I really look forward to that as well. And today is going to be no exception. I think we've got Mr. Medicare talking, right?
Medicare Man.
Tell us about it.
Good afternoon. Today's speaker is Sean Willingham. Sean, I've actually met Sean in various locations throughout the state and was very impressed with the knowledge that he has about Medicare. I don't know about your practice, but in our practice, we try to stay away from Medicare as much as we can, but we do get those questions, and I think that Sean's going to really help you be able to answer those questions for your clients on whether they should stay or go. Sean graduated from the University of Texas at Austin in 2002 with a BBA in finance, and then he obtained his General Alliance Life and Health Insurance license. He started his career selling Medicare supplements for an insurance agency that had agents throughout the United States. He was awarded the Rookie of the Year by Conseco Insurance Company and has been the highest producing agent the first year in the country. He separated from that agency in 2007 and formed K&S Insurance Services in San Antonio with his wife Kira, who's also a licensed health and life insurance agency. In 2015, K&S Insurance Services branded themselves as Medicare Man Insurance. I love that. Since 2003, Sean has helped thousands of individuals with Medicare by guiding them through the process, understanding the different parts of Medicare, and selecting the correct supplement or Medicare Advantage for them. He is certified, is a certified healthcare reform specialist from the Healthcare Reform Center and Policy Issue. He is a certified elder planning specialist from the Institute of Elder Planning Studies and a certified estate advisor for the National Association of Financial and Estate Planning. So I'd like for everybody to welcome Sean from San Antonio. Let me know if you.
Thank you very much, Rita. I appreciate that. I always love to hear about myself. But and also thank you very much to Dehu. Now we say Sahu in San Antonio, but it's Dehu here. Does anybody say Dahu? Is it? It's Dahu. Okay. It's Dehu. Okay, we got one standout here. She says Dehu. Dehu, Dahu, Sehu, Sahu. We have the same negotiations down in San Antonio. But I really appreciate being here today. I've enjoyed developing a business and a career in Medicare. You find that the assistance is truly needed, because when a person is approaching Medicare eligibility, they get just bombarded with telemarketing and print materials and information and misinformation, and a lot of misinformation. And so there's a lot of pitfalls that a person can stumble into. And so today, what we're going to discuss is the question of, should I stay on my employer health plan if I'm still actively working? Or should I make a transfer over to Medicare? Or should it be, somehow maybe a combination of the two? And it reminded me, when I was putting this together, it reminded me of that song. I think it's Crash. If I go, there will be trouble. Is it the Clash? Okay, there we go. He's like, please stop singing. It's the Clash. We know what you're talking about. Stop singing. But yeah, that's the question that people are posed with is, and you've got people calling you up on the phone, and what's their advice? Oh, go Medicare. You gotta go to Medicare. If you think you have to go to Medicare, I'm not going to tell you you're wrong, because I got something to tell you. And so what I found is that through this organization, the National Association of Health Underwriters, this is the organization that truly trains professionals to help people with their healthcare financing decisions, period. And so that's why I like to talk to groups associated with the Health Underwriters Association, because the more that we can educate ourselves about it, the more we can pass on to the consumers, the better the better decisions they can make, and it truly helps everybody. So I know that we need to go 15 minutes. So I'm just going to start my clock here. I'm sure I've gone for at least a couple, but so here. All right, and we'll go ahead and get started. All right. Now, what has happened? Everybody knows this. That baby boomers have changed the landscape of consumerism and of our country. What is built, what is purchased. They changed, I mean, even when baby boomers were born, they literally changed, you know the saying, they changed the landscape? Baby boomers actually changed the landscape. People moved into suburbs and created this entirely different structure of how we live and how we work. And that was all as a response to these babies. And these babies have carried that momentum all the way through their lives. And here we go, now we've got 76 million people were born between 1946 and 1964. And as normal, baby boomers have rewritten the norm throughout their lives, and they're continuing to rewrite. And now they're rewriting the definition of retirement. So what are some of the trends that we're seeing with the baby boomer population? Well, number one, living longer. They're in better health. 65 is not 65 anymore. And I got 65-year-olds that are ski instructors, and I mean it's a completely different definition. They're also doing a lot of retirement planning themselves. They're working longer, and they're also carrying more debt into retirement. But today we're going to focus on working longer. So many workers that are over the age of 65, what happens is they don't want to stop working, and so when they become eligible for Medicare, they have to decide between the two. Should I stick on my group plan, or should I make that transfer over to Medicare? And these are the questions that they come up with. A whole slew of them. You know, the first one, do I have to sign up for Medicare? Very, very common mistake is people believe because their neighbor told them, or their brother told them, or somebody told them, you have to sign up for Medicare, because if you don't sign up for Medicare, it'll be penalized later. And a lot of people are under the impression that the decision's already been made for them, which is not true. And that all comes with misunderstanding of lockouts and whether or not a person will be penalized. Also, individuals need to know how much Medicare will cost, how will it work with their other insurance, spouses and dependents. This is an important thing here, because sometimes if one with the employee is turning 65 but they're still working, well, to keep their spouse or their dependent insured, it might be a better option for them to stick on their employer plan, regardless of what Medicare is going to cost them. COBRA, we're going to talk about that here in a little while. All the different parts of Medicare, A, B, C, D. Most of the time they don't even know what all those different parts are. How do they sign up? Do they need Medicare supplement? What if they have an HSA plan? And then the last thing, well, is my neighbor has this, and my neighbor told me that, and my brother told me this, and his sister told me that, and so can you please give me some answers? So that's what the situation is there. Now everything. Boy, that was more difficult than I thought it was going to be. But I'd like to walk around a little bit. But everything that I've put in this presentation here, you can find yourself either on Medicare.gov or in the publications that are for free. That's the Medicare and You publication, and then the guide to who pays first. You can get all answers through these two Medicare publications. You can order on Medicare.gov. Really, really easy. Now, first thing that we're going to discuss is, how does my group health plan from my job, how does it work with Medicare? Well, if it's retiree insurance, Medicare is the first payer. Whether or not you need to sign up for Medicare is always subject to Medicare secondary payer rules. Who pays first? If Medicare is the first payer, then you have to sign up for Medicare. If Medicare is not first payer, then you don't have to. You can choose to, but you don't have to. okay? So if you're 65 or older and you have health coverage based on either you or your spouse's current employment and the employer is 20 or more, well then that employer plan is first payer. You don't have to sign up for Medicare if you don't want to. Again, you can choose to. Yes, sir?
20 more part and or full-time, right? Total employees?
It is, yeah, it is part or full-time. It's employees on payroll. It's not how many are on the health plan.
Right.
Yeah, so it's employees on payroll. So, and you can always find out, all of your groups will get a questionnaire annually asking about their members on payroll. You have to fill out the sheet, and they're always trying to figure out who's the first or secondary payer. And so the carriers always have on file who's first, who's second, if a person is of Medicare eligible age. Now, if you're 65 or older and it's 19 or fewer, well, now Medicare's first payer. So you do need to sign up for Medicare if the employer has less than 20 employees. So we're going to talk about this a little bit more here in just a little while. Now, I was speaking earlier with a gentleman about one of the common pitfalls, and that's COBRA. So it's important to note that what is not counted as current employment coverage, well, COBRA is not. So if a person is retiring and they're going on to COBRA, their ability to sign up for Medicare penalty-free starts when they retire and they have 8 months. COBRA lasts longer than 8 months, and so they can really get caught in a bind if they don't sign up for Medicare within 8 months of retiring. Is when their employment ended. Now, yes?
And HU has a bill that we're trying to change that legislation.
Absolutely. That was a good point. And that's one of the important things that NAHU does. And because the intent of the law, or the intent of the rule of signing up for Medicare, is to encourage people or discourage people from just not signing up for Medicare because they don't want it. They don't think they need it, don't want to pay for it. I'm in great health. Why would I, buy Medicare Part B if I don't need it? I'll just sign up for it later. And so that's the reason why they have that rule, is to penalize people for making that decision and encourage them to go ahead and sign up. But the mistake of staying on COBRA and just being locked out because of just an administrative error, that's not in tune with the intent of why they made that rule. And so it's a very, very good thing, an important thing that NAHU is trying to get that reversed. Other things, retiree coverage, doesn't matter what the size of the employer is, if it's retiree, Medicare is first payer. VA coverage is not considered current employment, and obviously individual health insurance is also not considered current employment. The important facts to consider when you're talking to somebody about potentially switching over to Medicare is, first, there are situations where Medicare might be secondary payer if they have accident insurance or workers' compensation. Medicaid never pays for services that Medicare covers. This is a good one. Medicare Advantage plans do not coordinate benefits with group health plans. There's never a situation where a person should have a group health plan from their job and a Medicare Advantage plan because they do not coordinate benefits. And that will happen. Somebody will stay on their job, they'll stay on their health plan from their job, their neighbor tells them you gotta sign up for Medicare, and then they see on TV there's a $0 premium plan and they sign up for that, and it can't even be used. Their employer plan is the first payer, and the Medicare Advantage plan never pays a dime because they don't coordinate benefits. This is just a good place to know. If you have a client that has a conflict of who's first or secondary payer, that's all done through the Medicare Coordination and Recovery Center. You can get that on their website. But oftentimes when somebody retires and they come off of the group plan and they go on Medicare and then they go to the doctor 3 months later, then the Medicare will still have their group plan as primary payer. So they have to call this number and tell Medicare that they're no longer on the group plan. Okay? Now, the potential pitfalls, well, If your employer insurance is secondary payer, Medicare beneficiaries, so this would be current employment 19 or fewer, where employer insurance is secondary Medicare. Well, in that circumstance, the employee might need to sign up for Part B. There's a little bit of confusion on whether or not you're required to sign up for Medicare if you're 19 or fewer, or not required to sign up for Medicare. We're going to talk about that here in a second. So this is a letter that I got from my insurance carrier. It's been redacted to protect the guilty. But on here, what it is, it says my group is my wife and I. So we are 19 or fewer. And so we got this letter in 2016 that said, beginning on your renewal date after July 1, if a member is eligible, not enrolled, eligible for Medicare but not enrolled, and if Medicare would be the primary payer, blank insurance company may reduce the member's benefits by the amount that would have been covered under Medicare Part B had they been enrolled. So what that means is that you're on a plan, the employee's on a plan of 19 or fewer. He says, you know what, I want to stay on this group health plan. He's told, or looks up, hey, if you're on if you want to stay in your plan for your job, just sign up for Medicare Part A. Well, if that person isn't diligent about reading their mail and they had a big claim, well, what that carrier was going to do is they were going to turn around, they were going to say, the first 80% of that bill is going to be covered by Medicare. So we're going to pay as secondary payer on the remaining 20%. So that would have been a huge surprise, obviously, if a person got hit with a big bill. Now, subsequently, on July 25th, which was after the date that they said this was going to go into force, so they basically said, based on guidance from Medicare, we decided not to do this. So there's a bit of a confusion as to whether or not a carrier can or will reduce benefits or basically pay as an assumed secondary payer. Now, the guidance from the government you're not hooked up to the web. You're going to have to trust me on this. If you go to Medicare.gov and you say, go to sign up, how do I sign up for Part B? And it gives you a drop down, and it has a section that says, should I sign up for Part B? You click on that. It says, it has a whole bunch of circumstances. The very first one is, I have coverage for my job. You click on that, and then it says, very plainly, the size of the employer determines whether or not you can defer your enrollment in Medicare. If the employer is 19 or fewer, sign up for Medicare when you're first eligible. They don't beat around the bush on it. That's the guidance on Medicare.gov. And then below that it says for 20 or more that you can defer and you can enroll later using what's called a special enrollment. But the guidance from the government is if you're 19 or fewer in current employment, sign up for Medicare. And that's my guidance as well. Because there's absolutely no way that when this letter came out, I could sit there and think, okay, in the last 15 years, how many people did I talk to that had this insurance company? You know, I got to call every single one of them up and tell them, oh, I'm sorry, you guys signed up for Medicare. It's impossible. So real clean, real easy, 19 or fewer, sign up for Medicare A and B when you're first eligible. Okay, so that's the story there. Now, in some cases, joining a Medicare Advantage plan can actually cause you to lose your employer or union coverage. So that's something that there's never a time to have an employer health plan and a Medicare Advantage plan. I haven't run into anybody that has been able to refute me on that, but there's just no reason to don't afford any benefits.
Can we go back to the should you sign up, because there were some who hold fast to the concept that you can never force somebody onto Medicare and off the group plan, regardless of their size. How do you counter it? Do you counter it with what you just quoted from the Medicare website?
They are not forced off the group plan. The group plan is secondary payer. They're still offered the same health plan as everybody else. It's a claim issue, yeah. So it's not a matter of them being discriminated against. They are still offered the group health plan. It's the same group health plan everybody else has. It just happens to be secondary payer. And so the question is can the carriers, if they had signed up for Medicare and Medicare would have paid the first 80% of the bill, can the carriers assume as secondary payer?
Right.
Well, I would imagine that before this letter went out in 2016 from this humongous carrier, that was discussed. And so based on guidance later on from CMS, they decided to change their mind. But it certainly isn't a permanent thing. And it doesn't seem like that it's written in stone that a carrier cannot reduce benefits, because in the Medicare and You book as well, it says that you may be required, if you're 19 or fewer, you may be required to sign up for Medicare Part B. And so that's why on Medicare.gov, it just simply says 19 or fewer, sign up for Medicare A and B when you're first eligible. With no penalties, exactly. So in these types of things, it's like, okay, well, I'm just trying to sit down with somebody and I'm trying to tell them, from the research that I've done, that we've done, and our community, like I'm part of, one the best resources you have with NAHU is the broker board. I post stuff, and all of us Medicare nerds throughout the country, we put, oh no, you can do this, or you can do that. And pretty much everybody's in agreement that 19 or fewer, sign up for Medicare A and B. It's just much cleaner, much easier that way. Now,
What if they wanted to first Social Security?
what's that?
What if they keep working and they want to defer their Social Security?
You can defer your Social Security, sign up for Medicare only, not Social Security. And you can defer Social Security up to age 70. If you draw Social Security, you have to have Medicare Part A. Why? I don't know. That's just the way that they built the machine a long time ago. So, yes, sir?
In my understanding, in Texas, you're not required to apply Part B by group insurance. The group must cover the Part B if you don't have Part B insurance.
Meaning that they cannot impose this.
The insurance company is responsible for Part B claims if you do not have Part B insurance. You must have Part A, like you said. But Part B is longer, and you can hold on and see Part B.
So, that would be, now, is this a recent thing? Like,
No, this is what I talked to Texas, and this is what they told me. You're not required, if you're paying a premium, and it used to be, if you were on Medicare, your premium would go down. Not anymore. Now you're being
no, that doesn't, that usually doesn't.
somebody else. So
If you have something that's solid on paper, that I would love to see that.
Yeah.
Because that would mean that this carrier, who insures millions and millions of people across the country, was completely and utterly wrong when they issued this letter to millions of people across the country. And oh yeah, you're right. It's just Texas. It's just Texas. So that would be, now, is that a possibility? Absolutely. Maybe that is the guidance that they got from CMS, was that, whoa, not in the state of Texas, you can't. But I have not seen that. I have seen in the Medicare and You book, it says you may be required to sign up for Medicare Part B. I have seen on Medicare.gov that says, if you are 19 or fewer, sign up for Medicare Part A and Part B when you're first eligible. I have seen this letter that went out to everybody that was insured by this insurance company. I haven't seen anything that says hey, you know what? In the state of Texas, if you don't sign up for Part B, you're fine. So if I see something like that, then I would love to see that, because where I am right now and meeting and talking with people is, if you're insured by 19 or fewer, a group of 19 or fewer, sign up for A and B, because it says it on Medicare.gov, because it says it in Medicare and You, and because I saw this a couple years ago.
Sean, the rule, I'm with you on that, because the health carrier might cover your claim, if you want to stay involved in that under 9.
We need to, yeah, speaking to speaker.
Yeah, here.
Right, so we all know we met our carriers in the market, say, if you still don't want to sign up for Part B, stay on the group plan, we're going to pay your claim. That's not the thing you should be worried about. When that person decides to come off that group plan, is Medicare going to let them get B in a special enrollment with no penalty? That's what you need to worry about.
There it is. Tamla, that was fantastic, because I knew exactly where I was going with this. Now, here's the thing. Where is it? I'm gonna come back here in a little while. This is the form for signing up for Medicare Part B. This form was created, I believe, in 1965. Okay? So this form does not speak to size of group at all. As a practice right now, could a person have been employed by a group of fewer than 20 employees for the past 10 years, they're 75 years old, and that plan, although they were never signed up for Part B, it's still paid as primary payer. They retire, they go down to Social Security, they turn in this form, they get signed up for Medicare Part B today, penalty free? The answer is yes. Yes. But I'm talking to a person today about what they can do, what I know they can do next year, 5 years, 10 years from now. Meaning that I'm not going to say that a person that's been employed by a small group can't walk in with this form and sign up for Part B penalty free. Yes, they can. But the guidance from Medicare on their website, in their book, simply says 19 or fewer, sign up for A and B. And so if it was me and I was turning 65 years old, which is the only thing really you could do, if it was my parents that were turning 65 or my friends that were turning 65, would I tell them, okay, so this is what you're going to do. You're going to defer Part B. You're going to need to read every single letter that you ever get from your insurance company, okay? Every last one. When your employer changes from one health plan to another, you're going to need to verify with that employer that you're not required to sign for Part B. You're going to need to keep documents religiously proving that you've been told over and over again that you don't need to sign up for Medicare Part B. I wouldn't do that myself. I wouldn't tell my parents to do that. I'd just say it's 19 or fewer. The website, the government website, and the government book says sign up for A and B. Sign up for A and B. If it's greater than 20, we know you can defer. We know that. They say that. It's obvious. But for 19 and fewer, it's not obvious. So my guidance to Medicare eligibles that call me up and they've got employed by a group of 19 or fewer, just I don't go into too much. I pull it up on Join Me, put it in front of them, go to Medicare.gov, say, let's see if the government says you should sign up for Medicare A and B. Oh, here you are. This is your circumstance. You're employed by a group health plan, click. Oh, you're 19 or fewer, click. First line, sign up for A and B. Period. Easy. It's all, our business is too complicated already. Let's not overdo it. Okay, so now to go back, nobody look about the exciting stuff that's coming up. Okay, but yeah, so that's another one of those situations where, do I know for a fact that a carrier is going to impose that we are paying as a secondary payer? I don't know that for a fact, but we're in the risk protection business. And for my clients, I say sign up for A and B. Okay, now, another thing that's important is if you have an HSA account. If you have a health savings account and you sign up for any parts of Medicare, that can mess things up. But then there's also a late enrollment penalty on the drug coverage that comes later. So we're going to talk about the potential pitfalls for Medicare if you have a health savings account. Health savings account and Medicare don't really, coordinate together or work together that well. And one thing that you have to remember with an HSA account, well, what happens with an HSA? Because I can't exactly remember when we pick it up, but if you enroll in any part of Medicare, you can no longer make contributions to your HSA account, even if it's just Part A. And when a person signs up for Part A, their Part A eligibility date goes back to the month of their 65th birthday or 6 months, whichever is shorter. So if they turned 65 3 months ago, then it's going to go back to 3 months. But if they turned 65 5 years ago, their Medicare Part A eligibility date, they sign up in June. Well, it actually goes back to January. And so any HSA contributions they made for June or January through June, they have to take back or plan ahead and stop 6 months before they're going to retire. So HSAs can be a little bit tricky when you're talking with Medicare. And again, COBRA doesn't count as credible coverage when you're enrolling in Part B. That's a big deal. That one's got to be fixed. That one's got to be fixed because it's something that just, it really just bites people that weren't trying to do anything. They weren't trying to be sneaky or tricky or anything like that. They just get burned because of the way the rule is. And then also you have to, yes sir?
I was just going to say that's another issue that DACA is definitely trying to fix is the HSA.
Oh yes, the HSA situation, yeah, because
an employer can be 100% of your HSA contribution, have 100% plan, it still doesn't qualify.
And why are we, we don't want people to save for their medical expenses? I mean, why not be able to make contributions to an HSA? I don't understand some of the rules. I don't understand why you get penalized for work income if you draw Social Security before your full retirement age. You're going to penalize somebody for working? That's not very smart. But these rules are what they are, so we just have to work our way through them. Now, and the last thing is anytime you're talking with somebody, make sure that you address spouses and dependents. Because lots of times if the spouse is 62 years old, then it can be detrimental if that person comes off of a group health plan and the spouse is left uninsured. Now, how much does Medicare cost? For most people, Medicare Part A is no premium. That's if you have 40 credits. Every year that you work and pay payroll taxes, or you're married to somebody while they work and pay payroll taxes, is 4 credits. And so you need 40 credits to have Part A, no premium. Part B is income adjusted. So anybody that has income less than $85,000 or a joint income less than $170,000 pays $135.50 for Medicare Part B. Okay, and then it goes up from there by brackets.
Hasn't it gone higher than the 500K?
Yes, the 750 is a brand new bracket. Yeah, 750 didn't exist last year, and they adjusted these. They didn't increase the amounts. What they did is they didn't increase the premium amounts. They took all the brackets and they bumped those up. So some people that had the same income that they did last year were moved from one bracket to the next because they changed the parameters. They bumped a lot of them up. But most people pay $135.50 during retirement. That's your base premium for Medicare. Let's talk about an example of somebody. So this here is Jane Smith. She makes $120,000. In 2017, they're always go 2 years before. 2019 premiums based on 2017 income. 2020 will be based on 2018 income. Automatically adjusted every year. And so Jane Smith would pay $135.50 for Part B. Then she would pay a Part B income-related monthly adjustment amount, which is a very, very tricky way of spelling tax. But they call it an income-related monthly adjustment amount. Very clever. $135.40. So that person would pay $270.90 for Medicare Part B. That covers your hospital and your medical. You have to add to it a drug plan. There are 20, actually that's last year, 24. I think there's 27 this year. They all vary by how much their premium is, what drugs they cover, what the co-pays are for each medication. So the only way really to figure out a drug plan for somebody is to go to Medicare.gov. You click on Find Drug and Health Plans, you input all that information, it'll actually generate a report, you can sort every single plan and say, for your meds at your pharmacy, this is the plan that has the lowest total cost. And it'll actually give you a report and show you how much that person will be paying for their meds all year long. The average drug plan this year is $33.19. So if we add that to Jane Smith, she's now in at what, $335.99. So A, hospital, B, medical, the taxes on the medical, the income adjustment, then the drug plan, and then they add an income adjustment or a tax on the drug plan. And hers would be $31.90. So now she's up to $335.90. At this point, she's got 80% of her medical covered, and she's got her drug coverage. Yes, sir?
Just a quick question. On Part B, can a person on Medicare Advantage apply to Part B?
Depends on which plan. For the most part, no, because Medicare Advantage plans come with the Part D built in. There are some that you can have them separated. Those are fee-for-service plans, and one thing is called the medical savings account. That's where you have a separate plan for your doctor, hospital, and you can buy your own standalone drug plan. Yes, sir?
On the Medicare Advantage plan, do you get away from the income adjustment?
No. There is no escaping the income adjustment unless you want to just start making less money. But then you still have to wait 2 years because it's always 2 years later that it actually goes down. Yeah, you're always paying the income adjustment. And then now we know Jane Smith has 80% coverage for her medical. She's got drug coverage. Most individuals will buy what's called Medicare Supplement, also called Medigap. Every insurance company's got them. They all have the same standardized plans, and they follow this format. And the most popular plan now is the Plan G. If you look at that, the Plan G, the way this chart works is every one of these boxes is a gap in Medicare. It's got a check mark. It means that it pays it. You don't have to. And on the Plan G, the only one that's missing is the Part B deductible. It's $185. So if Jane Smith buys this supplement insurance, the only inpatient or outpatient bill she's responsible for paying herself is a calendar year deductible of $185. So very low out of pocket on the hospital and medical. But look at her all in now. By the time you had the Part B premium, the Part B taxes, the Part D premium, the Part D taxes, and then the supplemental, I threw up $100 a month. Usually it's probably a little bit more than that. But she's all in at $435. So this person, if she's working for a company that has a relatively, it's greater than 20, and it's got a relatively generous plan, she might say, you know what, I don't want Medicare yet. I'm just going to do Part A, and I'm just going to stick on my group health plan. And what I'll do is I'll mail her a magnet, and then 4 years from now she'll call me up and say, hey, I'm done. Set me up with all the rest. That's the way it works. And what are the out-of-pocket costs? We already covered Medicare supplement, $185. Ma'am?
Could you go back and maybe everybody else caught it, but I didn't, the IRMAA on the Part D, why is that? What's that only for?
That is the extra tax charged by the government when you enroll in a drug plan. So on B and D, if you're enrolled in B or D, and you have income greater than $85,000 as an individual or $170,000 as a married couple, then they add taxes and they go in brackets.
So when you go to Medicare.gov and you're doing this, you've got all this pulled up for them, do those rates automatically come up on there? How do they know what they're using?
Oh, they're on there, but they don't tell you beforehand. So what happens is, and this is what I'll do with an individual, is we'll do an analysis. And Jane Smith, this example right here, before she ever signs up for anything, she tells me what income bracket she would be in. I say, this is what the federal government charges for extra taxes or income adjustments per bracket. Where do you fall? She'd say, oh, I make $120,000, so I would fall in that bracket between 107 and 133.5. So her income adjustment on Part B, and I wish the laser were, can everybody see that? Yeah, and so then the income adjustment on Part B is 135.40. You add that to the base premium 135.50, so she pays $279 for Part B to the government. And then on the drug plan, she falls in this bracket here where her income adjustment is $31.90. So it doesn't matter what drug plan she picks, the government's going to charge her an extra $31.90. And that's all charged by the government. You can either taken out of your Social Security or you get quarterly bill in the mail if you're not drawing Social Security. And that's all done automatically. So if Jane Smith doesn't know this, and she says, oh, my next door neighbor said Medicare costs her $135, $135.50. My health plan for my job is $300. I'm going to sign up for Medicare. Well, when that person signs up for Medicare, Medicare then asks the IRS what the income was, and she gets a letter saying, congratulations, you've been so successful in your life that we're going to charge you an extra for Medicare. But it doesn't happen until afterwards. So you have to pre-calculate it beforehand so that she can make the educated decision of, I'll just stick on my employer plan. Because, no, they have this on Medicare.gov, but they don't make it obvious.
And if I understand correctly, that once you retire, let's say your income drops below 85, it's going to be 2 years for staying higher.
Correct. It'll be 2 years. I mean, depending upon when you retire. If you retire at the end of the year, you retire at the end of 2019, you're going to pay, it'll drop in 2021, which is not technically 2 years away, because December 31, 2019 is 366 days away from January 1, 2021. So it's the most recent income tax that they have on file every year. But yes, you're right. It will fall once you're 2 years after.
I've had most times been successful with the doing it to the Social Security office to prove the loss of that income now, not wait 2 years. If you'll have work, or you go to a lesser bracket. Maybe not all the way to 135.
Yeah, and they will do it off of, there's not like an exact formula for it. I've had one, she retired, she sold her house, she had, because it's all income, it's not just earned income, it's your capital gains, everything. But she was actually a school teacher. She went there and she said, hey, this is 1 year. It was really hot. They eliminated it entirely. If you're a person that has really high income and falls down there, it's like, you should have stayed some of that money.
Situation of spouses that both be 65, one, retired, and the spouse isn't working, doesn't have enough credits. What need to even get Part A? What happens there? Can they transfer credits, or how does that work?
For Part A, you earn credits either off of while you work or while you're married to someone while they're working. Meaning that you can't marry somebody that's 64 years old. You're 64 years old, marry somebody, and then, hey, I want to apply on their credits. No, you didn't earn the credits. You have to be, if you're like a homemaker and raise the kids at home, you're earning credits while your spouse is earning credits. So you do become eligible. The only difference is that you can't enroll online that way. You actually have to go down to the Social Security office. But that's the only difference between those two, because you have to go down there and they have to somehow pull it from this system, put it in that system, get you enrolled. But you do have the credits, spousal. Yes, ma'am?
No question. So when you retire, you have your lump sums coming in from your 401ks. Is that considered income for that?
Everything's considered income for yes, everything capital gains. It's what's called your modified adjusted gross. So if you Google modified adjusted gross, it's your adjusted gross income, plus you have to add back anything that you was not counted, like non-taxable Social Security, qualified dividends, capital gains, everything.
So if somebody was retired for 5 or 10 years and they haven't been paying it, and all of a sudden, they hit that 71 and a half, and they have to do the 70 and a half when they do the minimum. Yeah. So does that change? Is that when that changes and they start paying a premium, or no?
Yeah, so this would be more of a tax question, which is the answer is though yes, it would. Once you start taking the income, then that's going to be. I think that's 1099 interest income or something. But yes, that's all going to start. So it doesn't count if you've got an IRA. And it's got $1 billion in it, and you're 65 and you wanted to go from $1 billion to $1.5 billion the next 5 years, none of that is accruing. That's not counting against you until you actually start taking that money out. And that's the modified adjusted gross income. So
that was your Social Security
plus everything, work income, capital gains, everything. It's easier to define what is not included in modified adjusted gross income, and the answer is practically nothing.
Loans against the universal life.
Because that could be, yeah, there's very, very little that doesn't count. But and I wouldn't plan my entire income just around Part B premiums. But in this circumstance, really the question is I'm James Smith, I'm still working, I have a plan for my job, what do I do? And the answer is figure it out beforehand. Don't sign up for A, B, and D and then get surprised by the income adjustments after. All right, so we did a supplemental. On the drug coverage is a little bit complicated, but basically you're covered with a catastrophic limit of $5,000. If a person's on a Part D drug plan, they're paying co-pays for their meds. If they have super expensive meds, once they hit $5,000, then they're paying 5% of the cost of their meds. Now let's look at John Smith. John Smith, he makes $50,000 a year, okay? So he doesn't have any income adjustments. So his Medicare premium is $135. There are a lot of Medicare Advantage plans that are really attractive. They have low co-pays. They come with they're really attractive plans to retirees. And John Smith might look at this and he might say he doesn't have any kids at home that he's insuring. His spouse might already be on Medicare, or maybe she's got her own insurance from her job, so he's free to come off of the group health plan, go on to Medicare, pay $135, and he's super happy. That's just because his income is $50,000. Now, how do you sign up for Medicare? Well, there's 3 enrollment periods for Medicare. Initial enrollment is when you're first eligible. It's the 6 months that surround your 65th birthday. General enrollment is if you did not sign up for Medicare when you were first eligible, and you don't have what we're going to talk about here in a second, but special enrollment. General enrollment is what you want to avoid. General enrollment starts January 1, it ends March 31, and you're not effective until July 1. So if a person is on COBRA ends April 1, and then they walk down to the Social Security office to sign up for Medicare Part B. Medicare says, sorry, you can only sign up for the general enrollment, which ended yesterday. So come back between January 1 and March 31 next year, and your Part B will be effective July 1 of next year. So that individual, because they were burned by just the rules with COBRA, is locked out of having medical coverage for, 15 months? Yeah, and that's the dangerous part. Now, so you want to stay away from general enrollment period. And what we're talking about now is special enrollment period. Special enrollment is if you have coverage from your job. Now, we talked about this earlier. The special enrollment period does not say that it had to be coverage primary Medicare, that it had to be 20 or more employees. The ability to sign up for Medicare Part B just simply says that if you've had coverage from your active employment, you can sign up for Medicare Part B anytime while you're still working and up to 8 months after. So those 2 rules, they don't really jive with each other. You know, one says has to do with employer size, this one doesn't, but when there's confusion, I just err on the side of safety. So if in the example we were talking about earlier, Jane Smith, she decides she wants to stick on her employer plan. Well, when she does retire, she gets this form, she takes it down to the Social Security office, and they'll sign her for Medicare Part B penalty free. And she'll be really thankful for it because you know what? She had a better health plan from her job. She saved all that money that she would have spent on all those premiums and taxes with the government, and she's super happy about it. So how do they calculate later on penalties? Part A usually has no penalty, so no premiums. We won't talk about penalties in that one. Yes, ma'am?
So I have an employee who just hired, goes on 65 or older, goes on COBRA. Why would they not want to go on Medicare Part B?
Very good point. The vast majority of the time, the person does want to go to Medicare, meaning that because Medicare is likely to be less expensive than what they're going to get from COBRA, likely. But not all COBRA plans are created equal. You might be in the $750 plus. Medicare might be $600 a month. Your COBRA plan might be less expensive than that. So the problem doesn't present itself. It's not like the majority of people are going on to COBRA instead of Medicare. But the point is that if the person does decide that they want to go on COBRA, then that person needs to know that they have 8 months to sign up for Medicare Part B, not 18 months. But you're right, most of the time a person would decide, hey, I'll go over to Medicare because it's going to be less expensive than COBRA.
And then Medicare, so we're on COBRA, I'm on COBRA for 5-6 months, I signed up for Medicare Part B, and it's retro, when is the effective date of Part B? That's what I would say after I retired?
It'll be the first day of the month after you turn in your application. Yeah, so that's the, or if you request, you can request up to 90 days away. But if you walk in May 1, it'll be effective June 1. And most of the time, a person that's going off of a group health plan will choose Medicare as opposed to COBRA. But if they do choose COBRA, make sure they know they don't have 18 months, they have 8. That's the important thing to sign up for Medicare Part B. Okay, so how do they impose, or how do they calculate the penalties? Part B penalty is 10% for each year that you did not sign up, if you did not have employer coverage. If you have employer coverage and you sign up during special enrollment, there is no penalty. This is just the general enrollment people that did not sign up for Medicare when they were first eligible and they did not have a special enrollment. Part B, they'll get an extra 10% for every year that they were not on Medicare. For the prescription drug plan, they count up the months and 1% extra for every month. So that's the 50 minutes there. So I'm gonna wrap it up. I want to respect everybody's time here. I know you got work to do this afternoon. But that's how they calculate the penalty on Part D. You want to avoid penalties on Part A, B, D, all of them, obviously. There's one time that you really can't avoid this penalty. You just have to make a person aware. If they are on a high deductible health plan, they're getting contributions to their HSA, and they decide they don't want to sign up for A or B or any part of Medicare because they want to keep getting those contributions, just let that person know that when they do sign up for Medicare, the Part B penalty is going to be imposed back to their 65th birthday, even though they didn't sign up for Medicare at all. That's just another one of those odd things, and you tell them how the Part B penalty is calculated, and that person may decide, okay, I'm willing to pay that. You know, I get these contributions to my health savings account, I'll pay that penalty.
Even if they had credible coverage?
Well, most I skipped that. Most high deductible health plans are not deemed credible coverage on Part D. Most, some are. But if it was credible, then you're exactly correct. But most high deductible health plans are not credible coverage on Part D. But that's just an odd situation. And I've had people that are on high deductible health plans, they got an HSA, I say you're going to get charged extra 1% for every year. Say 1% of what? Say right now it'd be 1% $33. So if you defer for 3 years, that's 36% of $33. And say, okay, I'll just keep getting my contributions from my employer. I'll pay that penalty. And that's just an odd little situation. Okay, so I don't think we need to go through how to calculate it. It's really pretty simple. Key factors, always, first thing, who's primary, who's secondary? Are you making a contribution to a health savings account? What are your cost and coverage details on your employer plan? What's your deductible? What's your premium? What's your modified adjusted gross income so I can figure out how much the government would charge you for Medicare? And then cost and coverage details on a Medicare plan. So then you can put them side by side. Here's your group, here's Medicare, which one do you want? And then finally, make sure and address the effect that it could have on spouses' independence if the person terminates their group coverage. And then finally, calculating the enrollment penalties. Other than that, I know Medicare can be relatively complicated. And it's been a fabulous business for me, and I would encourage anybody to do it. It's an industry that's growing, obviously, and I love it. But I also understand that there's other some people that just want to find a solution. If you don't want to do it yourself, and you just want somebody to help that individual, you can give me a call. All we do is Medicare. I don't have any group plans on the books. We're all Medicare. And so if you'd like to, there's my phone number. You take out your cell phone, put Medicare Man, put my phone number there, and when one of these situations arises, just give me a call and I'll help you figure it out. Okay? Any other questions? All right, thank you.
He was good, wasn't he? Yeah. Okay, great. Thank you, Sean.
Thanks. That was fantastic, huh?
Is this your phone up here now?
It is. Thank you. Thank you. Okay. So wrapping up here. Okay, remember our next meeting, May 15th, and that'll be on this building. Of course, June, we have that income tax planning for businesses, so we sure don't want to miss that. Anything else for the good of the order? Okay, appreciate it. Make sure you, how are we handling the CE sheets? Anybody? Let's collect them. Yes, Tom. What's that? Oh, in July, we also are going to have Rusty Rice here to help install all the offices. Thank you. Thanks for coming.
Thanks, Dave. I need your paperwork.